Today we're going to be talking about hydration. Hydration means that the resident is taking in enough fluid. Dehydration means that the resident has lost so much fluid that they're suffering some type of problem. The consequences of dehydration include health problems, behavioral abnormalities, and accidents. Staff must understand the obstacles encountered by a demented resident in maintaining enough fluid intake. They must also be able to recognize the warning signs of dehydration. To begin with, let's talk about the brain regions that are involved with drinking enough fluid.
Hydration is very important to good resident care. We all need water to stay healthy. Our body loses water every day, even when we don't urinate. Residents need at least 6 glasses of water every day. Residents who don't get enough water become dehydrated. Dehydrated residents may become irritated and may wander. They may also be at higher risk for infection. Dehydration is when your body doesn't get the water it needs. It can lead to drowsiness, dizziness, and confusion. Serious dehydration can be a medical emergency, and the resident may need to go to the emergency room. Residents who do get enough water are calmer, happier residents. They're less likely to get infections. They often have better appetites, and it's easier for them to use the toilet. Demented residents have trouble getting enough water. They may forget how to fill a glass or how to use a water pitcher. They may be confused about how the water fountain works. Sometimes they may not even realize that they're thirsty. Residents with late-stage dementia may have trouble swallowing and may be in danger of choking on liquids. It's very important to make sure that residents take in at least 6 glasses of water every day.
It's important for a resident with Alzheimer's disease to drink enough fluid in order to stay healthy and to feel well. Let's look at the parts of the brain that are involved with drinking enough fluid. Here we see a model of the skull and the brain. In order to drink enough fluid, first of all, you have to see where the water fountain or the glass is. So your eye, which is located right here, sends information to the back of the brain, which recognizes the glass or the water fountain. Once it's recognized, then that information is sent forward up here to a part of the brain called the parietal lobe, which is located right above your ear, that tells you how to pick the glass up or how to turn on the water fountain. Let's look at these brain regions in a larger model of the brain. The eye would be located right here. It would send its information back, where it would be interpreted here in the occipital lobe. So you would look at the glass and say, that's a glass. Then the next thing that would happen is that this part of your brain, which is located right here, would help you grab the glass, pick it up, put it to your lips, and drink. This is how our brain helps us to drink enough fluid. Now let's see what happens in the brain of a resident with Alzheimer's disease. Over here, we see 2 brains, one from a normal person, the other from a person with Alzheimer's disease. Here's the part of the brain located right here that sees the glass. Notice how shrunken it is in the resident with Alzheimer's disease. Here's the part of the brain that helps us pick up the glass. Notice how shrunken it is in the resident with Alzheimer's disease. Or if we cut it right here and look in these sections, this is a normal occipital lobe. This is an occipital lobe from a resident with dementia. Notice how reduced in volume it is. This person would no longer be able to recognize a water pitcher or a glass. This is a parietal lobe from a normal resident. This is a parietal lobe from a resident with Alzheimer's disease. Notice how reduced in volume it is. This person would no longer understand how to turn on a water fountain, how to pick up a glass, or how to get it up to your lips. So you can see that the parts of the brain that are involved with drinking are oftentimes damaged with Alzheimer's disease. That's why you have to help the residents drink enough fluid so that they'll feel well and stay healthy.
When bringing a resident something to drink, it's not enough to just leave the drink near the resident. The resident may not know what to do with the drink and may not get the fluids needed for proper hydration. To make sure the resident stays hydrated, you need to help. Pour the drink into the glass and hand it to the resident. If necessary, help the resident bring the glass to the mouth and drink. Remember, a hydrated resident is calmer, happier, and healthier. Residents may not know if they need something to drink.
Good morning, Miss Hedges.
And how are you?
Okay. Have you had anything to drink?
No, ma'am.
Okay.
You need to help forgetful residents to make sure they get the fluids they need. Demented residents' brains are damaged, and they may not remember how much they've had to drink or how much they need to drink.
When I take care of my patients, I don't want to look at them as just a paycheck. I want to look at them as a challenge. And anytime you have a challenge, you're going to try to do your best with that challenge. And I always put love. In giving care and understanding. As far as giving them something to drink, make sure you give them small sips. If a client can hold if a patient can hold a glass, all well and good, but still watch them in there.
Always assume that residents need more water. Residents need 6 glasses of water every day. That's a lot of water. Residents can get the water they need from other drinks or even foods that have water in them. Milk and juice can be good sources of water. Pudding, Jell-O, and soup have water in them too. A typical bowl of Jell-O can count for 1 glass of water. You must watch residents drink and eat to make sure that they each get the 6 glasses of water they need every day. If residents are not properly hydrated, many problems may develop. Poorly hydrated residents may become agitated, are more likely to wander, are at a greater risk for infection, and may suffer from constipation. By the time residents realize that they are thirsty, they need 6 extra glasses of water in addition to their regular daily intake of 6 glasses of water. Residents who become dehydrated may also become agitated, are at greater risk for infection, may suffer from constipation, have low blood pressure, and may become dizzy or even fall. It's important for you to be able to recognize the signs of dehydration. Residents who urinate less than usual or are constipated may be dehydrated. Dehydrated residents may also develop dry mouth and may have waxy skin. One way to test if a resident is dehydrated is to gently pinch the skin. If the skin stays pinched up, the resident is dehydrated. By the time residents are dehydrated, they need 16 extra glasses of water over the next several days in addition to their regular daily intake of 6 glasses of water. Severe dehydration is a serious medical emergency, and a severely dehydrated resident may need to be transferred to the emergency room. Notify your nurse or supervisor anytime you're concerned that a resident is not drinking enough fluid.
You still got to realize that patients are not doing this because they don't want to do it. They're doing it because they have an illness. I have talked to my patients 1 minute and 5 minutes later, they don't know me. But still, if you're kind enough and nice enough and treat them with respect, they'll take to you.
Demented residents need assistance in every phase of drinking fluids. First, approach the resident in a friendly manner. Remember to smile and speak calmly. Second, pour the fluid into a glass or open the milk carton or other container. Third, show the resident the drink, place it in the resident's hand, and encourage the resident to drink. Fourth, make sure the resident finishes the whole drink. Remember to be patient, friendly, and calm throughout the drinking process. Imagine you're in a strange country and you're very thirsty. You enter a store and try to find something to drink. You look around, but you can't read any of the labels. Is this a drink, or could it be poison? How would you feel if you were thirsty and couldn't find something to drink? What would make you feel better? Please stop the tape and discuss ways you can help residents get the fluids they need. Demented residents may forget the appearance of a glass, water pitcher, or fountain. Just because fluids are available to residents does not mean that they will drink them. Residents need your help and reassurance to stay hydrated. You need to watch residents to make sure they get the 6 glasses of water they need every day.
Mr. Jones suffers from Alzheimer's disease. He has been irritable and restless over the last few days. You notice that he hasn't been drinking as much as usual. Mr. Jones tells you that he is thirsty. What can you do to help Mr. Jones?
Give him lots of fluids to make up for the extra 6 glasses of water that he needs in addition to what he regularly drinks each day.
Give Mr. Jones 1 or 2 extra glasses of water. He'll be fine.
Give him some extra Jell-O. That should be enough.
You don't need to do anything. Being thirsty is just a part of the Alzheimer's disease.
Mr. Turing has moderately severe dementia. His wife tells you that he looks thirsty and dehydrated. His tongue looks dry and his skin looks waxy. Mr. Turing has a pitcher of water in his room. What should you do?
Thank his wife and tell your nurse or supervisor immediately that Mr. Turing may be dehydrated.
Tell his wife he has water in the room if he needs it.
Thank his wife and tell the nurse when you get around to it. There's no need to bother anyone right away.
Tell his wife that you know when he needs water and she should just leave you alone.
Ms. Hardy has moderately severe dementia. She's been hospitalized twice for dehydration and bladder infections. Her family asks you to keep her well hydrated to prevent more infections. What should you do?
Tell her family that there's a water fountain in the hall.
Tell Miss Hardy to remember to drink lots of fluids.
Give Miss Hardy a glass of water.
6 times a day, put a glass of water in her hand, help her raise it to her mouth, and then watch as she finishes the glass of water.
Ms. Davis suffers from Alzheimer's disease. The doctor is about to send her to the hospital for dehydration and pneumonia. Her tongue is cracked and her skin is loose. She looks dizzy. What's wrong with Ms. Davis?
She just missed some of her fluids. She'll be fine.
She is seriously dehydrated. She'll need several days of IV fluids to replace the fluids that were lost over a 1 to 2 week period.
This is a normal part of Alzheimer's disease. Everyone gets seriously dehydrated.
She shouldn't be dehydrated. She had water in her room and she didn't say she was thirsty.
Mr. Palmer recently had pneumonia and now he seems more confused. He's recovering from the infection and his doctor told you that Mr. Palmer needs to drink lots of water. What should you do?
Don't worry about it. He always drank plenty of water before.
Make sure he drinks lots of water. Mr. Palmer may get confused and forget to drink the water he needs.
Leave an extra pitcher of water in his room. He'll get the message.
Tell the doctor to stop bothering you. Mr. Palmer will drink when he wants to drink.